Hi, I'm Amy Flory. I'm a physical therapist, and this is number 2 of 4 segments for demonstrating exercises that will help you stabilize your back during winter sports. You should have watched the first segment, and you should be a pro at the abdominal brace by now. And in this segment, we're going to be introducing some resistance through hip movement. Again, you should have no back pain. You should adhere strictly to the form. If you do have back pain that persists for more than 2 days after doing the exercises, then you need to train or treat your back as if you have sprained it. If you do have soreness for 2 days or less, I certainly would not increase the intensity of the exercise. Now we're going to do an exercise called a bridge, utilizing a gym ball. And you're going to be using an abdominal brace contraction in combination with a little bit of a pelvic tilt to further stabilize the back. When you do exercises with your back on the ball, you want to start seated on the ball, and then you just roll down so that your head and shoulders are supported on the ball. Okay, here I am in the relaxed position. You can have your fingers on the floor at first, but you want to progress to having them resting on your hips. So here I'm going to do my abdominal brace. I'm pulling in, then I'm going to tuck my tail under, and then raise my hips so that my hips are extended and I'm flat from the shoulders out to my knees. I'm going to hold this for 5 to 10 seconds. Then, keeping the tilt and the abdominal brace, I lower, then release. So all together, pulling in, tuck, lift. Holding 5 to 10 seconds, lower down, release. Alright, now to progress the difficulty of the bridge, you can do it with one leg supporting you. So again, you'll start with your pulling the belly button in, tucking the tail under, then lift one leg, and then extend the hip. You can use your fingers for balance if you need to on this one. We just did an exercise where we're concentrating on stabilizing the spine and the pelvis while the hips are extending or straightening or moving back behind us. But you also have to be able to keep the spine stable while your hips are flexing or coming forward. So we're going to practice one like that now. So start by using a chair. The further down your arms or hands are placed, the more challenging it is. So we'll start here with arms on rest. In a kind of modified push-up position, you're going to be pulling in your lower abdominal muscles in the abdominal brace, and then keep your back straight as you lift one knee. And only go as far as you can, still maintaining a neutral spine position. If I go any further, then my back has to start to curve, but we want to only go as far as you can maintain that position. So bring it up and hold, 5 to 10 seconds, and relax. I can go down further into more of a plank position. Same thing, back should be in a nice neutral spine position. I bring one knee forward. Again, only go as far forward as I can still maintain that neutral spine position, and hold for 5 to 10 seconds. Okay, now we're going to do the same exercise but with the ball. This is a lot more challenging for stabilizing the upper quarter together with the abdominal muscles and also hip work. So again, it's the same exercise, just a much more challenging surface for the upper extremities. Okay, so we're here, we're working really hard to begin with, and then hopefully I don't kill myself. Bring that knee up, holding for 5 to 10 seconds, and back out.